Zonisamide, also known as Zonegran, is often prescribed in combination with other medications to help prevent and manage seizures in individuals with epilepsy. It is classified as a sulfonamide anticonvulsant and a carbonic anhydrase inhibitor. Despite its effectiveness, the exact mechanism of how zonisamide works to prevent seizures is not fully understood. It is important to take Zonegran as directed by your healthcare provider, typically once or twice daily, and at the same time each day for optimal effectiveness. Always follow the prescribed dosage and timing for the best results. Before taking Zonegran, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually 1 to 2 times a day. To prevent kidney stones from forming, drink plenty of liquids while taking this medication unless your doctor instructs you otherwise. If you are using the capsule form, swallow the capsules whole. If you are using the liquid form, carefully measure the dose using a special measuring device/spoon. Dosage is based on your medical condition and response to treatment. Your doctor will start you on a low dose and slowly increase your dose. It may take several weeks or months to reach the best dose for you and to get the full benefit from this medication. Use this medication regularly to get the most benefit from it. To help you remember and keep a constant level, take Zonegran at the same times each day. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. Tell your doctor if your condition does not improve or if it worsens. Common side effects of Zonegran may include dizziness, drowsiness, trouble sleeping, lack of coordination, lightheadedness, loss of appetite, diarrhea, or double vision. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to alert your doctor immediately if you experience any serious side effects, such as mental/mood problems, speech problems, decreased sweating, sudden pain, or painful urination. In some cases, anticonvulsants like Zonegran may lead to depression, suicidal thoughts/attempts, or other mental/mood problems. If you or your family notice any unusual changes in mood, thoughts, or behavior, including signs of depression or thoughts about harming yourself, it's important to seek medical help right away. Additionally, Zonegran may cause metabolic acidosis, a serious metabolic problem. Seek medical help immediately if you experience symptoms such as bone pain/breakage, rapid breathing, fast/irregular heartbeat, sudden tiredness, or severe drowsiness. It's also important to be aware of very serious side effects, including easy bruising/bleeding, eye pain/redness, vision changes, signs of kidney problems, and signs of liver problems. If you experience any of these symptoms, seek medical help right away. While rare, a serious allergic reaction to Zonegran is possible. If you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects. If you notice any other effects, be sure to contact your doctor or pharmacist. And in case of any concerns or questions, do not hesitate to reach out to your healthcare provider. Before taking Zonegran, make sure to inform your doctor or pharmacist about any allergies you may have. It's also important to let them know about your medical history, including any liver or kidney disease, lung/breathing problems, long-term diarrhea, metabolic imbalance, special diets, or mental/mood problems. Zonegran may cause dizziness or drowsiness, and alcohol or marijuana can make these effects worse. It's important to avoid driving or using machinery until you know how this medication affects you. Also, avoid alcoholic beverages and talk to your doctor if you use marijuana. If you are planning on having surgery, be sure to inform your doctor or dentist about all the medications and herbal products you are using. This medication may make you sweat less, which can increase your risk of heat stroke. Be careful when doing activities that may cause you to overheat, such as hard work or exercise in hot weather. Make sure to drink plenty of fluids and dress lightly when the weather is hot. Older adults may be more sensitive to the side effects of Zonegran, especially dizziness and lack of coordination, which can increase the risk of falling. Children may also be more sensitive to certain side effects, such as decreased sweating, heat stroke, or metabolic imbalance. If you are pregnant, only use this medication if clearly needed, and make sure to ask about reliable forms of birth control while taking Zonegran. This medication can also pass into breast milk, so consult your doctor before breastfeeding. When taking Zonegran, it's important to be aware of potential drug interactions. This means that other medications or substances may affect how Zonegran works in your body. Always keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Zonegran include carbonic anhydrase inhibitors, such as acetazolamide, and orlistat. Other medications, such as those used to treat seizures, rifamycins, and St. John's wort, can also affect the removal of Zonisamide from your body, which may impact how Zonegran works. Your doctor may need to adjust your dose of Zonegran if you are taking these medications. It's also important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as alcohol, marijuana, cannabis, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers. Additionally, be sure to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Always ask your pharmacist about using these products safely. If someone has taken too much Zonegran and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, severe dizziness, and loss of consciousness. It's important to remember not to share Zonegran with anyone else. Your doctor may also recommend lab and medical tests to monitor your kidney function, bicarbonate level, and complete blood count while you are taking this medication. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. Make sure to take Zonegran at the same time every day. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and take your next dose at the regular time. Do not take double the dose to make up for the missed one. Make sure to store Zonegran at room temperature, away from light and moisture. Do not store it in the bathroom. If you have the liquid form, make sure to throw away any unused medication 30 days after opening the bottle. Keep all medications away from children and pets. Remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. If you have any questions about how to dispose of Zonegran, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.